everyone, and thank you for joining us. I am Leslie Cecil, current president of the Kentucky Optometric Association, and on behalf of the KOA, I would like to thank you for joining us today for today's webinar, whether you are here live or listening to a recording at a later time. The KOA is pleased to host this training session for all Kentucky optometrists and staff to help equip our profession for the new driver's vision testing requirements, which start next month, and to also share many answers to questions that we've already received from across the state from our colleagues. At this time, it is my pleasure to introduce Dinah Bevington, the Executive Director of the KOA, who will provide an overview of today's webinar and get us started. Dinah, I will turn it over to you.
All right, thank you, Dr. Cecil. I know that several are still getting added right now to the webinar, so no fear, you have not missed anything yet. Wanted to provide a broad overview of what we're going to cover so that you know what to expect. First, we will hear from the Transportation Cabinet. The Cabinet has already been tasked with the full driver's licensing requirements, and now they have the vision requirements that they're responsible for. So we will hear from the Transportation Cabinet about the processes and some additional insight. Then we will dive through, the KOA will walk you through the actual certification form and some answers to questions that you have already submitted. So we will do that. Throughout the webinar, you are welcome to submit questions at the bottom of your screen. There's a Q&A where you can submit questions. We hope that we're going to answer a lot of those throughout the presentation itself, but the ones that we do not, we will answer at the end. I want to let you know that this will be recorded. All of the information that is contained in here, you can get at any time from the KOA. So don't panic about that. We can review this as needed, and you can always contact the KOA. We will have for our members a specific place on our website full of resources for you to help you navigate this. So without further ado, I would like to turn it over to Commissioner Matthew Cole, who is the Division of Driver's Licensing Commissioner at the Cabinet. He and his team have done an amazing job trying to navigate these new changes. And so we're just really grateful that they are here this afternoon to talk with us and answer some more of our questions. So Commissioner Cole, I'll turn it over to you.
Well, thank you very much, Dinah. We're pleased to share this information with you all today, just give you a better overview of the program, how it's going to be executed. So without any further ado, I'll jump right in and get started. Let's see here. Here we go. So essentially, starting January 1st of 2025, all Kentuckians must undergo a vision screening to renew their driver's license or permit. This new state law promotes highway safety by ensuring all drivers maintain the required vision standards for the roadways. Vision exams performed by optometrics and ophthalmologists can satisfy the requirements for patients who are due to renew within 12 months. I'm going to go ahead and hop into that renewal period right now because that can be a little confusing on dates. So when you pull your driver's license out, you have an expiration date on it. Whether you have a 4-year license or an 8-year license, you can renew that license once you get to a 6-month window, what we call the 6-month renewal window. So six months prior to expiration date, any transaction that you do with your license will trigger a renewal. So if you come in and you needed to do a name change, an address change, you wanted to update to a real ID, there's no option for you to just get a license for the remaining 3 months and 2 days of that. So in that 6-month window, you will renew. So that's where people are going to want to work this into their office parameters, is essentially part of the onboarding of the patient into the offices. A good best practice would be, are you renewing your license sometime this year or in the next 12 months? Because the form that will be completed upon this screening, it will be valid for 12 months. So if they say, no, I don't renew for 6 years, don't worry about the form. There's no reason to do it. They don't need it. So if they say, yes, I renew tomorrow, my expiration date is tomorrow, or it's 12 months away, then feel free to use that form that they can use. So just wanted to clarify that can be a little squirrely, but we don't want to put any more work on you to sit there and say, well, I'm going to fill out a form for you every single year when obviously we only need it when they're getting to that renewal window. So the two options for vision screening that all Kentuckians will have will be option one, and that's to come into a KYTC regional office. They're going to use the same little Optrex 1000 box that everybody used when they turned 16 and they had to go see KSP and do your permit test. It's the exact same machine. It's the exact same process. That is free to everybody. But then the second option, which is that vision specialists and medical professionals can also do vision screenings, eye exams, and provide the form that we've created, so that can be submitted online. Our IT team is working on putting that extra layer into our online renewal, so they could just simply upload the form there to kind of say check the box for this type of the process. It can be attached to a mail-in form. So if somebody says I'm not real technologically savvy, I'll just take a renewal form. I'll add this vision screening form that I got from my eye doctor. I can send this in. So those are two options to where you won't have to go into the office, or the person can make an appointment or be a walk-in, bring the form that they got from their doctor and submit it at that time. At that time, we would not do vision screening in our office because your form would supersede our part of the process. Moving on to the next slide, this shows the visual acuity and visual field requirements in accordance with KRS. In our office, to pass, they would have to do 20/40 or better, horizontal visual field of 30 degrees left and right, and vertical visual field of 25 degrees. When it comes to corrective lenses, we want them to wear the lenses. We want them to wear the glasses. We want them to be in driving condition. So some people think, well, I can't pass that without my glasses. We wouldn't begin to ask you that. We want you to be able to use your corrective lenses to make sure that you can pass the thing, because it basically comes down, can you see to the state standard or not? And glasses can help to cover that deficiency. So in passing patients, this is the section that we've kind of snipped off the form. And so you would complete the appropriate section to reflect that there's a passing screening. So in the pass there, you give in the original form, the first check, you're attesting to the fact that the person meets all of the requirements and should proceed with their renewal in our offices. The second box says, their vision has been corrected with lenses, but that should be reflected on their credential as well. So again, the form is valid for 12 months from the patient's eye exam at your office. And like I say, all they have to do is work the math to see if they're going to be in their renewal window during that 12 months to see if it's necessary at that particular office visit. So for failing patients, this one probably won't go as well for everybody. But the second box there shows the fail, and that would be where the person does not meet the standard. They may need additional treatment, surgeries, anything that falls to your all specialty, of course. And then we would ask that you submit a copy to us via email or mail. You can mail it to us, your choice, either way. That way we can put it on the record that we know if a person comes in, they have an issue, kind of thing. We don't want it to be lingering. So that's just part of the good communication of the process there. As for promotional materials, we'll have rack cards, posters, handouts, banners, social media graphics, and digital ads. Those can all be obtained by reaching out to Drew Roberts there at the bottom. There's his email address. If you have any suggestions on other materials you think you may need, just let us know, and we can always put that into consideration. We want to get the word out. We want to make it a positive thing. This is going to get people either the eye care that they need to be able to see, or it will get them off the road so they're not a danger to other people. As the chief administrator for the medical review board, it's one of the worst things in the world to know that you're taking someone's driving privileges away, but you kind of have a choice. You're either taking this one individual off the road, or you're putting everybody else at risk. And that's a tough thing. And I know that, it's something that you all will share as well, as there's going to be a lot of pressure from patients to say, me, we went to school together, kind of things. And we all have to be diligent due to the legal liability of these transactions. When someone attests on that form that someone meets the requirements, that's putting somebody's legal name on the line, and it's not worth it for any of us to not be 100% accurate on all these transactions just due to the liability that can be attached to them. So not to bring everybody down, but just to make sure everybody's aware, it's kind of a reality of what we face every day. That's really all I have in the presentation. Obviously, I'm open to take any questions. I have Tina Ferguson's name down here. She is our assistant director in the Division of Driver's License that's kind of spearheading this program. So her email address is there. If you have any questions after the fact, feel free. This is not a one-time thing. We're open door all the time. You can send me emails. You can send her emails. Ask us questions. Make sure you feel comfortable. I know that there's some frequently asked questions that are going around that'll be covered. And if we can help fill in any gaps, we're always glad to do so. But I know I threw a lot of information at everybody. If there's, Donna, do you want me to go ahead and take some questions now, or was there something else you wanted to hit on before then?
No, let's go ahead and hold off and walk through a couple more of the questions we've already received. And I think maybe that may help the additional questions we received. So thank you so much for giving that additional insight. I am going to now share my screen, and hopefully you can see the actual driver's vision testing certification form. We've had quite a few questions about this, and so I thought it would be helpful just to walk through this actual form that Commissioner Cole was just mentioning. We will also talk about the different things you need to do as part of your exam and what your standards are. First thing here, if you look, this form is revised December of 2024. A prior form was circulated. If you already filled out one of those forms for your patients, it is okay. There were no substantive changes. My understanding is the cabinet will accept these beginning in 25, even if it was the older form. Do not panic. But from here forward, please utilize the 1224 program, or the 1224 form here. The first part of this form is exactly what Commissioner Cole just walked through, which was the different processes that can be utilized, how they submit the form directly to the Division of Driver's Licensing. If they pass, they bring it to the licensing site, and if not, then it is mailed separately. So again, this is just outlining what that process is. Moving down to section 1, this is what the actual driver or your patient will be completing. This contains their information. There is also a very important block here where they attest that the information that they are providing is accurate and that their vision form can be released to the transportation cabinet. I've had questions asked about patients who may refuse to let the form be released. I would recommend, and I believe that most would recommend, that you have them go ahead and attest that they can release this form and sign it and date it before you move further. That way the form, you have all the proper authority that you need to forward it along. Section 2 is the big section for optometrists, vision specialists to complete. The first paragraph here can appear a little tricky, and what Commissioner Cole mentioned was the 2040 visual acuity. That is what is tested at the regional licensing site. This first paragraph outlines what that initial test is and what those initial standards are. It is 2040 or better at the regional licensing site or at KSP, with a horizontal visual field of at least 30 degrees to the left and right, and vertical visual field of 25 degrees above and below fixation. That is the initial test. If a person that is examined during this initial screening does not meet those requirements, they are then referred to the vision specialist, which is you all. The vision specialist acuity standard is 20/60 or better in the person's better eye. So that has not changed. The only thing that has changed is that this 2040 is now referenced on the form that you were seeing. But typically, when an individual is referred to a vision specialist from KSP for their initial licensing, they just said they did not meet the standards, and you were testing for the 20/60. So do not let this confuse you. The visual standard for a vision specialist, the acuity is 20/60. Had some folks think that maybe it has always been 20/40. I think there may have been some changes in the early 2000s, but this is what the change is, and nothing within these new requirements changed that piece. So the visual acuity is 20/60. Scrolling down, once you've tested for those different criteria, this is the pass and the fail section that Commissioner Cole just went through. The first box indicates that they met or exceeded those standards, and then that you will provide the original copy to the applicant or to your patient. The second box here is where you would indicate if corrective lenses are mandated. You do not need to indicate any specific medical information about these patients. It is just completing those two boxes if they pass. Similarly, if they fail, you mark the first box here in this gray form. You provide the original form to the applicant, and then you are going to mail it on to the Division of Driver's Licensing, which is what Commissioner Cole just walked through as well. The next section is for those people who are the credentialed specialists, and we'll get to that in just a moment. But you would complete this first block. Then down here in section 3, this is the actual certification and the reporting. First block here, you indicate you're the vision specialist, licensed to practice optometry. Your license number goes here, as well as obviously licensed in the state of Kentucky. There are out-of-state vision specialists who can complete this form, and they will complete that with their license number in their state. Moving down, the form will only be valid if signed and completed less than 12 months prior to the date of application or renewal. So you would indicate right here the date of when you examined this patient. And as long as that date is within 12 months of when they go to renew their license, this form will be accepted. Then certify here that you performed the exam and that the information is correct, and then simply put in your contact information here below. Section 4, we'll address in just a moment, is the opportunity for an individual to appeal your decision if they do not agree with your denial. And so that process is set forth here and how they go about appealing that decision. And we'll talk about that in a little bit as well. That's the actual form that you will have. Again, get copies of that form. You can contact the KOA, and we'll be happy to do that as well. And then we'll have an additional place where you can request that in just a moment. I'm now going to go through a PowerPoint of some of the most pressing questions that we have received. Let me see if I can get this started. Let's do slideshow. You know, this is always going to work this way. There we go. Okay, so again, important highlights and frequently asked questions that we've already gotten. So bear with us and we'll kind of walk through this and then answer your questions at the end again, as indicated. Quick reminder, Commissioner Cole just went through this, but all drivers, regardless of age, are required to meet these minimum standards starting in 2025. So this is drivers who are going to be renewing their driver's license or getting their license reinstated, and it still applies to drivers who are getting their initial driver's permit or license. So the same vision standards apply for all licensing actions starting in 2025. Previously, as this group is really well aware, only drivers who were getting their initial license, typically around the age of 16, were tested. So this will apply again to all drivers. There are 2 exemptions to that. Individuals who have an active CDL license, the commercial driver's license, they already get their vision tested annually. So they do not have to go through this additional testing process. And then also there is an exception for the military and spouse who will be renewing their license. So those are the only 2 exemptions that exist. There are 2 ways, as Commissioner Cole mentioned. You can get your vision tested. You can have your vision tested, on site for free at one of the regional licensing sites or by KSP, or you can bypass that with the form that we just walked through. So this was something the legislature wanted to make sure was as easy as possible. For those who may not be aware of the new requirements, it will be there available on site for you for free. For those who want to bypass it, they'll have that option as well. They already see their doctors on a regular basis. This makes great sense. How are the on-site vision tests conducted? Commissioner Cole mentioned this already, that there will be the typical Optec 1000 vision screener that is currently used by KSP. KSP will do that for the initial licensing. They are still responsible for that portion. For those who are renewing or getting their license reinstated, that will be at the transportation cabinet at those regional sites. And they are using the exact same Optec 1000 vision screener. I actually had the opportunity to go look at it earlier this week and see how it will work. It is not too, laborious to take. It's very quick to administer and get done. If a driver passes on site, they're able to then move forward onto their next licensing sites. But as we know, if a driver does not meet those minimum vision standards, then they are referred to a vision specialist, which is optometrist as well as ophthalmologist, for that additional testing and additional vision correction. So that is how that process works. When, completing the certification form I walked through, there were 2 different boxes. Vision specialists can complete this form, but there's also an additional group of individuals who can complete it. So we want to make sure that you're aware of the 2 different types. Obviously, vision specialist, optometrist, and ophthalmologist, you will complete a form when someone is referred to you because they failed the initial test, or you may have a patient ask for the form to bypass the on-site test, whether that's part of a comprehensive exam you're already, providing, or an additional individual just contacts your office and wants the form prepared. So vision specialists will complete it in those 2 instances. There are also a group of certified medical specialists that will be approved to complete these forms. Those are approved physicians, osteopaths, and advanced practice registered nurses, APRNs. That is a completely different process to be credentialed by the Transportation Cabinet, and they are only providing that initial form. So they provide that the screening for that initial form. If someone fails that form, it gets then sent to a vision specialist. So are all licensed physicians, osteopaths, APRNs able to complete the form? No. They have to be credentialed by the Transportation Cabinet, and then they are eligible to start completing those forms. They'll get a credentialed licensing number that they will then supply on the form. And then if the person again fails at that point, they're referred to the vision specialist. As an optometrist, you do not have to be credentialed. You do not have to take any additional steps before you start completing these forms. You are defined in law as a vision specialist, and you already have the authority to conduct these additional exams based upon your training and knowledge. So again, 2 separate groups, but again, vision specialists do not have to take any additional steps before completing these forms. Back to the minimum vision standards that we highlighted a bit ago. Visual acuity of 20/60, best corrected in at least 1 eye, and horizontal visual field of at least 30 degrees to the left and right side of fixation in the better eye, and vertical visual field of at least 25 degrees above and below fixation in the better eye. This is the only thing that has had a slight change. Currently, when testing for the initial licensing, the horizontal field was 35 degrees. It has been reduced to 30 degrees to accommodate many of the tests that are utilized to test visual field. And we felt that 30 degrees was appropriate, and working with the Transportation Cabinet, they established it at 30 degrees based upon that recommendation. If a person meets or exceeds these standards with the corrective lenses, then they are mandated and restricted to use those corrective lenses whenever operating a vehicle. So this is the standard that you are testing for as a vision specialist. And again, these are minimum standards just for license renewal. The visual acuity standard is different when tested by vision specialists. As indicated, the 20/40 is what is done at the initial test conducted on site. 20/40 is the minimum visual acuity for tests conducted by the certified medical specialist when completing the form. 20/60 is the minimum visual acuity for tests conducted by vision specialists. That has not changed. So again, if you continue to have any questions or concerns with that, please let me know, but the 20/60 is the acuity. So looking back at the form that we just went through, some frequently asked questions. Where can an optometrist get a copy of the form? I mentioned earlier that you can get it from the KOA. It is not available on the public website. The Transportation Cabinet has concerns with posting these forms and making them too available. You always have bad actors in that respect. You can also request a copy from the Transportation Cabinet at the email that is listed here. Again, all of this information is available at any time, and we will be providing FAQs with all of this information as well. But that is where you will be getting the form. Patients or a referred driver that comes to your office will not be provided a copy of the form. When they fail on site at one of the regional licensing sites, they're given a specific card that just directs them and tells them what their next steps are. They are not given the form that needs to be completed. Big question that we continue to receive: can I complete a form now for an exam that I have already completed? The answer is yes, you can complete that form. The exam must have taken place in the 12 months prior to when they renew their license. So as indicated on that yellow box on the form, if your examination, the date of your exam is within 12 months of when they go to renew their license, that form can be accepted. The cabinet will only start accepting the forms in January, but you can complete those forms now. Here's an example. You complete an eye exam October 1, 2024. Their license expires February 1st, 25. You can complete the form and they'll be able to submit it at that time. Is a completed form required by all drivers to obtain or renew their license? No. This is only an optional way for them to bypass the on-site testing that is conducted either by the Transportation Cabinet or KSP. The only time that a form would be required is when they have failed that initial screening, that initial on-site testing, and are referred to a vision specialist. Again, that initial testing can be done on-site or by one of the other credentialed specialists, but they will then have to bring the form with them. As far as your responsibilities after you complete the form, if they pass the minimum standards, as indicated, it is their responsibility to bring the form when they go to the Transportation Cabinet or KSP. You do not forward an approved form. It is recommended that you give the original to the patient and always that you maintain a copy for your records, but it is their responsibility to maintain that form and submit it on their behalf. A little bit different if you have an individual that failed the minimum standards. You must email or mail a copy of the failed form to the Division of Driver's Licensing, as Commissioner Cole indicated. The email address is here, as well as the address to mail the actual form. It is also included on the form. So you will see that on there and it will direct you what you need to do. Had a concern about emailing because at one point, on the form it asked for not just their driver's license number, but the social security number if they don't have their driver's license. You always want to make sure you are using a secure email. If you have concerns with that, mail the form to the Transportation Cabinet. Those are the two ways that they are willing to accept it. Provide the original still to the patient and maintain a copy for your records. So in all instances, you want to give the original back. You want to keep a copy. The only time you have to mail it on is if they fail. Am I required to maintain my copies in any particular manner? No. It is up to your business practice how you maintain these forms, as well as what process you use whenever you complete them. Obviously recommended you maintain a copy of the forms. Frequent question we get is, where on the form do I indicate that they are restricted to driving with the corrective lenses? We walked through that earlier. That's in that section 2 portion in the green section. There are 2 boxes in that pass section. The first box says they make it. The second box says that they need to be restricted. And so all you do is mark that second box. Here are some really quick and easy questions that we got about the form. Does it have to be in color? When I provide a copy, does it need to be in color? The answer is no. Transportation Cabinet has advised that color copies are not required for them to accept your forms. The colors are used really to make it easier for you to complete and to break it apart a little bit, but black and white copies are acceptable. Can I email a completed form to a patient as opposed to giving them a copy, or can I also send them an email copy? Yes. Cabinet has advised that if you prefer to email the form rather than give the copy, that is fine. The providers are encouraged always to maintain a copy of anything that you email. So just always keep that in mind. Can I use a stamped signature when completing the form? Answer is yes. Transportation Cabinet says that that is acceptable and they will accept that form. This is a pretty frequent question that we have been asked and want to make sure that we kind of dive into this a little further. Can I charge a fee for completing a form? Yes. Providers are permitted to charge fees for completing medical forms. However, you should carefully consider that the fee is based on the amount of work that is actually involved. And also make sure you notify your patients. So, looking back at the form, there's a lot of writing on it, but it's actually pretty easy for providers to complete and submit that form. It was intentionally done that way. It is not requesting specific health information in order for it to be pretty easy for your office or for you to complete that form. In most instances, optometrists will likely be completing the form as part of a comprehensive exam, which would not warrant any type of an additional charge in most instances. However, I was contacted by a clinic and want to share this information in regards to a situation where they feel they may charge to complete the form. And that is when an entirely new patient reaches out and just wants the form completed. Similar to how they would reach out to a credentialed medical specialist. They just want the form completed. They do not want a comprehensive eye exam. That particular clinic thinks that they're going to get a lot of those requests. What they plan to do is to create an intake form, taking the basic demographic information of the patient along with a signed disclaimer that indicates that a comprehensive eye exam is not being performed. The form itself and these minimum standards do not require a comprehensive eye exam. You may determine to do that within your discretion, within your medical practice, if that's what you want to do, but it is not required. So their intake form will indicate that they are not performing this comprehensive exam, that the individual acknowledges that, and that also on the form that they will be taking or being charged an administrative fee to complete this action. So in this instance, they're considering $15 for the completion, the administrative work there, but it will be whatever you decide. As far as how you go about this, each office will be different. Your office may be able to accommodate these types of one-off requests. You may not be able to accommodate it. It is entirely up to your discretion and your administrative practices. The only formal thing that you really need to keep in mind is that there is an ethics decision from the AMA saying that these forms really, that any charges that you charge, any fees that you charge for any medical form that you complete, whether it be an FMLA form, whatever it might be, it needs to be reasonable and based on the amount of time that you spent. So again, you can, but there are certain things to keep in mind. If you have any questions about that, we are happy to walk you through that as well. Can optometrists in another state complete these forms? Yes, we already talked about this. As long as they're fully licensed in another state, they will simply indicate what their licensing number is. They're a vision specialist. They can complete those forms. Actually, out-of-state medical specialists can also be credentialed. My understanding, they've had a few that have reached out and wanted to do that as well. We have several bordering states that will have drivers that ask for these requests. So they are able to submit those forms. Can a driver appeal a failed form? This is really important as providers when you're treating patients and you're conducting an exam and you're telling them that they do not meet these requirements. Again, these requirements were established by the legislature and by the transportation cabinet. You are simply completing your form and saying that they do not meet those standards. But yes, they can appeal that decision. They have 20 days to appeal the form that was submitted, and it goes to a separate entity called the Medical Review Board. All of that process is outlined on the form. Commissioner Cole also highlighted it as well. The Medical Review Board is a completely separate entity within the transportation cabinet. They've got different standards. They have a different process of reviewing situations. So please keep in mind that the Medical Review Board standards, or when you're asked to complete examinations per the Medical Review Board for an appeal that's pending, this is very different from when you are doing these minimum standards for all drivers. So again, an appeal of this is an appeal of the minimum standards that then goes to the Medical Review Board. You are not responsible for having to do all of the different requirements that are currently in place for a Medical Review Board examination. If there are questions about that, we can answer that as well in a minute. So switching gears, huge question about what exactly is required. If you're saying we don't have to do all the Medical Review Board requirements, what is required for minimum vision standard testing? Are there any specific visual field or acuity tests that are required? No, there is no specific type of exam that is required by law. An optometrist can use your medical discretion when determining the best way to test these minimum standards. For example, when you're testing a visual field, you may first utilize confrontation testing as you currently do. If that is what you would normally utilize in this instance, you have the authority to make your decisions on the best manner to test for these vision standards and otherwise appropriately treat your patient. This was a really, really important part of our discussions with the cabinet as they were deciding what processes would be required throughout the regulation process. The KOA pushed to make sure that medical discretion still remains in place and that you are not required to use any particular test. Dr. Carolyn Munson, who is the current legislative chair, was very involved with these discussions. And Dr. Munson, if you would not mind to elaborate a little bit further about why this is so important and why there are no specific tests required.
Absolutely. Thank you, Dinah. So for everyone performing a comprehensive exam, or if you are going to choose just to do a screener for the visual acuity and then the visual field, you will go through the exam like you would any other normal comprehensive exam. So if you use confrontations to evaluate visual field and you feel that the patient passes confrontations, then they meet the requirements. If your office uses something like a frequency doubler or another visual field screening and the pre-testing, and they pass that, then they again pass the visual field screenings. If you have someone that comes in that's had a stroke and they have a whole, left side loss or right side loss or both, and you look at that and you do your confrontations and they fail, then medically we would normally, as a standard of care, then proceed to doing a visual field to more accurately look at that visual field using something like a 24-2, a 30-2, or maybe a 120 screener. So you will use your normal discretion that you use every day on all of the patients that you see to decide which specific type of testing you use for a visual field. But we did advocate for the optometrists and ophthalmologists to not have to use a specific test for the driver's license renewal. This is a completely separate topic from the medical review board that does have more specific requirements of what tests are used. But for the purposes of driver's license renewal, it is what you normally use in your comprehensive exam to evaluate the visual field ability of the patient in front of you.
Great. Thank you very much for clarifying that. And I know that you're going to be available to answer any additional questions as well as we move forward. So when, the question is, when you're signing this form and you're attesting that they meet the minimum visual standards, do you need to provide copies of those test results? The answer is no. Obviously, this indicated we have no formal visual field that must be done. If you do decide to do that, you're always encouraged to maintain copies of those records. You should document exactly like Dr. Munson said, what you did to establish that the minimum standards were met. But in no instance will you be sending medical records or supplying that along with that driver vision certification form. So document in your file, make sure that you've got that, maintain copies, but you do not need to forward those along. Another question, am I responsible if a person does not wear their mandated lenses and they cause an accident? No. If you advise the patient of the restriction and you also indicate that on the form that their driving is restricted, the burden is on the patient to adhere to the requirement. You are only attesting when you fill out this form that they meet those standards at the time of your examination. And then you are setting whatever limits at that point that they need to also keep in mind. So going further on that, if you feel that additional restrictions should be placed on a patient, they meet the visual field, they meet the acuity standards, but they have a condition, cataracts, something that should prevent them from driving at night or other limitations. That is not what you are testing for or indicating on this form. You are only indicating that they meet these minimum standards. You should, as always, if you feel they can safely operate the vehicle and meet these standards, but have some limitations, you should counsel your patient as usual. Document that you counseled them and told them what they should be doing. And then if you feel it is appropriate, then you refer that to the medical review board. There is no mandatory requirement right now to refer those situations to the medical review board, but in your professional discretion as you handle these issues, nothing has changed in that regard. You document in the file the guidance that you've given, but you are, again, only talking about these minimum standards to drive, not any additional things that you think a patient needs to keep in mind. So, am I required to see a person that has been referred to a vision specialist? We expect a large number of increases of individuals who will be looking for vision specialists to fill out forms once they may not meet the standards at the regional licensing site. You get a call at your office. Do you have to see that individual? No. There is no legal requirement for you to examine a referred patient. And there's also not a requirement to see them within a specific time. We recognize there's going to be a time crunch in many of these instances. That is not something that you have to do. Many optometrists have full schedules already, and it's difficult to accommodate requests, but you really are encouraged to assist when it is feasible. And so when your offices start considering that, how can you accommodate these referrals? Go ahead and start making those plans now, especially if you know that there are a limited number of specialists or optometrists in your geographic area. You know, this is a public policy that we support. We don't want to make it difficult for individuals to safely operate motor vehicle. Again, it might create additional headaches and strains in your office, but we also want to be as accommodating as reasonably possible. So there is no requirement that you have to, but on behalf of, the visual specialists, it is something that we want to obviously support and help accommodate when possible. So some additional things to consider before we get on to any specific questions today that were raised. Determine what process will work best for your office. Consider asking whether or not they have an upcoming expiration date during your patient intake, as Commissioner Cole indicated. Consider how your office will handle the various types of requests to complete the form. As indicated, if you have an office that may receive a lot of calls just to complete the form versus how you will work that into your comprehensive exams, consider how you are going to administer this additional, request that you may receive. And then the additional resources that you can place in your waiting room or in your patient communications. And you saw earlier how those can be requested. They are available. The KOA can also assist in helping get that word out within your office. Another huge part that you can do as a vision specialist is educating others. Reassure patients and others that this is going to improve the safety of Kentucky roads. And most importantly for this group, these new requirements are going to result in improved overall vision health. We know many things will get caught that may have gone undetected. So again, reassure others that this is actually a really good thing for the Commonwealth. Big important piece to hopefully, avoid some additional stress is that individuals can renew their driver's license up to 6 months before the expiration date. No one should be waiting until the very last date to get their license renewed. That will help avoid the urgent last minute request that you get. The individuals that are told, right when they need their license that now it's expired and it cannot be renewed. This is a renewal process. Licenses are not being taken away, but they cannot be renewed. I was asked whether or not the cabinet can extend the renewal time if someone is having to get an additional vision exam. That will not happen. They cannot extend that time. So help get the word out that early renewal will make it easier for everyone. And then also, driver's licenses can be renewed as indicated every 4 or in some cases 8 years. So encourage your patients to return for routine exams between these license renewals. Encourage them also to reach out if there are vision changes, but also keep in mind that if there are vision changes within those 8-year time lapse from when you last saw them, you are not responsible for that. You are only attesting that they met the standards at the time you completed the form. So that actually gets through all of what we had wanted to cover, our prepared material, Dr. Cecil. And so I know that we likely have had some questions submitted and want to see now if there's anything that we need to address at this time.
I think Dr. Munson has done an excellent job keeping up with all the questions. And so I'm trying to look and see if there's any open questions. Dr. Cottle had asked if we are obligated to report to the medical review board if they don't meet the requirements. but I think that you just maybe answered that. So
Yeah, that is up to the doctor's discretion. So if they fail either coming to get their form for their driver's license, or if it's just someone who comes in and does not have 20/60 vision in their better eye or the vertical and horizontal visual field requirements, there is not a mandated or obligation for the vision specialist to report them to the medical review board.
Okay, any other questions, anybody? You can either raise your hand or type the question out. I think we give everybody a few seconds there to just in case. Carolyn, were there any questions that you answered that you don't feel like were covered? I mean, I think that everything was covered, correct? But I know you answered several questions. Was there anything that you want to
No, the
repeat?
one thing that did come up is that if you do not have a HIPAA compliant email, you may not want to email that information to the transportation cabinet. You may want to just go ahead and do traditional mail for something like that. But other questions, either I've answered in the Q&A or Dinah has done a great job actually addressing them within the content of this webinar.
Yeah, and Dinah and I were talking, I think, earlier this week about that. If you don't have a HIPAA compliant email, you can actually mail the form in. So that would be the alternative, correct, Dinah?
Yes.
Would be to mail the form.
Yep, that's correct. And it is on the form as well. The majority of what we covered as well will be in a much easier to utilize FAQ document rather than having to go through and listen to the 45-minute presentation. But as always, if you have additional questions that were not covered or just some concerns, do not hesitate to reach out to the KOA and we will be happy to assist.
Okay, well, I guess there's no further questions. So we would like to thank you again for your time today and your support on this important initiative. We recognize that it will be a change and a transition, not just for Kentuckians across the state, but also for our offices. As you work through these changes, please do not hesitate to contact the KOA, as Dinah said, with any questions at any time. We are always here, and the staff is awesome. They're amazing, and they're always there and available for you.